Hi there. I'm going to be doing a brief lecture on disaster management. So I'm just going to pull up my PowerPoint here. Okay, what a time to be discussing disaster management. Of course, this most perfectly connects to the pandemic that we're currently living through. And so I'll have some brief examples in this short PowerPoint about that. And then I'll show you what other resources I want you to be taking in for your reading and learning this week. So first, just to be clear, there are two main categories of disasters. There are natural disasters and there are man-made disasters. Fires is something that we usually see in California as a natural disaster. And if you can hear that, I apologize. Those are my children screaming in the background in the hallway. Anyways, life goes on during a pandemic, right? So the link here is to show you the top 5 most deadliest natural disasters around our world from 2019, if that's interesting to you. And then the other type of disaster is man-made. Most recently, these have been gun violence related, school shootings. This picture here is from a synagogue shooting that happened in Pittsburgh in 2018. These are, as you know, very tragic and events that feel like they could have been prevented. And one of the hugest disasters that has happened in the United States history is 9/11. Over 2,700 died in that event, 300 estimated to be first responders, including firefighters. And this event, as you know, rocked our world, rocked our country, and completely changed the way that we do disaster preparedness in our country for the better. So there's 4 phases that I want to talk to you about today. I want you to be clear as to what these phases are and what kinds of things they entail. So the first phase of disaster management is prevention. And that's things like what we do now with airport security post 9/11. So we now have lots of screening and security measures in place to make sure that people aren't getting onto planes with weapons or other dangerous items. And that is one way that we can prevent future terrorist attacks like the one of 9/11. Preparedness. So there's lots of different ways that we try to prepare for future disasters. And one of them is in our national stockpile. That's something that's protected by the federal government. And your assigned podcast listening for this week actually talks about the federal stockpile and the way that our government has worked to try to have an adequate supply of ventilators and other PPE items. And we are running dangerously low on those things currently, as states like New York are emptying the stockpile for their great need regarding the COVID pandemic. But other things that we have in our stockpile are smallpox vaccines stored for every single American, which is pretty wild because it was a few decades ago that the World Health Organization stated that we had now eradicated smallpox from the globe, but it is a horrific disease that wiped out millions of people across the globe for centuries before a vaccine was developed. And so if it were to ever come back in a widespread way, we have vaccines to deal with that. Another thing that we do to constantly prepare is we do a statewide disaster drill. This takes place twice a year. That link here is for you to click on and you can see how our state sets that up. Oftentimes they recruit nursing students to be pretend patients for these drills, which is really fun for students to do. We've thrown that out in the past as an option for public health hours. Obviously that won't be happening this semester, but it usually takes place in November and April with all the major hospitals. And the most recent disaster drill in November of 2019 was based on a scenario of flooding. Other ones I've seen recently have to do with gun violence, bioterrorism, and fires. So the third aspect of disaster management is responding once the actual disaster or crisis has occurred. So it's all about figuring out how to save lives and prevent further injury to people. And so different things are involved in that. Rescuing people from dangerous situations, triaging is a huge one, stabilizing people, transporting them to the best facilities possible, and then providing treatment. And then the final piece is recovery. This is one that often can be overlooked, but could potentially be the most important in the sense that it has the long-lasting effects that can really hurt communities if recovery is not taken into account. And this is where we really stay with communities long-term, help individuals and groups of people begin to rebuild their lives, restore economic health, physical health, all the different aspects of health. This will be a crucial piece of our own recovery when we finally get through this pandemic, are able to develop immunity as a nation and as a globe. How do we repair our economy? Because it's taking an enormous dip. Millions of Americans are no longer working. And as you can imagine, this is not something that we will just recover from immediately when people start going back to work and being allowed to go out and live normal lives. Also, something that often goes unchecked is the mental health in the recovery process. And no matter what the disaster, crisis, or trauma, there is going to be a huge mental health impact on those who've survived and perhaps suffered some sort of loss. And so mental health resources are a huge piece of this recovery phase. Something I just want you to be aware of that was developed in response to 9/11 is this enormous federal plan called the National Response Framework. I have links at the bottom for this and its companion document, which is the National Incident Management System. Basically, these templates, these frameworks for how do we coordinate efforts on a federal level, on a state level, on a local county level, so that we can all be responding well and appropriately and sharing resources, communicating with each other if we were to have a large scale disaster. All of this stuff is housed within Homeland Security. However, just want to note that with this current pandemic, recently the White House actually put FEMA, so Federal Emergency Management Agency, let them be at the helm with our current disaster response. So FEMA has now taken charge of that. But ultimately, there are 24 agencies involved within the Department of Homeland Security, and this whole setup happened in response to 9/11. What do you think? Does this all sound familiar? The phases of disaster management should ring a bell, and it really goes right along with the levels of prevention that are foundational to public health. So real quick, just some examples of how we as nurses can promote the levels of prevention when thinking about disasters. On a primary level, we want to assist individuals in getting prepared in case there ever was a disaster. So primary prevention, remember, is complete prevention before something strikes. How can we make sure that people are ready? Ready San Diego, the link is here, is a fabulous resource for us to share with our clients. And it offers helpful tips on how to create a disaster kit. So extra food, water, perhaps toilet paper, in our garage, cash, copies of medical records, extra prescription, filled prescriptions for necessary medications, an evacuation plan within the home, a plan for the family on where they're going to meet outside of the home if perhaps they get separated. So all of these things are important tips and tools that we can offer our clients to get ready. Then I have two different links here from the CDC. The first one is providing specific guidance on how to prepare for COVID before it strikes your community in a huge way. So similar to Ready San Diego, but just COVID specific. And then the second link that I want you to click on is the healthcare facility readiness. This is especially important. It connects with the COVID patient simulation that you're going to do for your required reading. And basically talks about specifically how healthcare facilities can prepare staffing-wise, PPE-wise, hospital room-wise, ventilators-wise, all the different things that go into preparing for a surge of COVID patients in the facility. Secondary is screening, right? Screening and identifying those who are most at risk. This is something that, as you know, we have faltered on in our country. But this is incredibly important for disasters, is figuring out who is at high risk so that you can get them into either prevention mode or early treatment. And then tertiary, that's the easy one for us, right? Is once people have been hit by a crisis, triaging them, helping them to get the best treatment as quickly as possible, reducing the chance of death or long-term disability. So my question to you, I'm bringing back the wheel once again, Public Health Essential Services wheel. Where does disaster management fit on here? Curious where you think it fits. And the answer is that it's pretty much all places. Disaster management is definitely a piece of the assessment. We're constantly monitoring our community, the health of our community, and especially as we gather numbers on daily COVID cases in our county, that's the ways that we're monitoring our health. We're informing and educating the community on what's happening and how to best prepare, how to take care of themselves, how to self-quarantine, how to know when to get tested. We're linking people to services when they do need treatment or testing. And we're assuring a competent workforce. And right now that is a huge push as Governor Newsom has developed the California Health Corps in order to recruit as many healthcare professionals as possible to meet the demands of a potential surge in our state and in our counties. So the last thing I want to touch on, I'm not going to read all these slides. This is pretty self-explanatory. These are slides that came from the county. And it's describing an awesome opportunity for you called the San Diego County Medical Reserve Corps. And what's interesting is when I clicked on the link to see if you like what it looked like currently to register, it actually takes you right to the California Health Corps registration form. So this is something that's the same idea as California Health Corps, and now it's just merging into kind of a new group, a new way of organizing healthcare providers to be recruited for a crisis. But the Medical Reserve Corps has been around for a long, long time, and it's basically an ongoing collection or registry of healthcare providers, licensed healthcare providers that can be called up in a time of disaster. And so all of the information is here, kind of talks about when it was established shortly after 9/11, why it was established, what it's for, kind of the organization of it, all the different trainings that they do. They do at least 2 full-scale trainings each year. There's different specialty teams, pictures of what the trainings have looked like around San Diego, and how to volunteer. And so here, right here is the link that I told you. When I click on it now, it just immediately goes to California Health Corps and has a way for you to register. Now, when you used to be able to just do the general MRC, you could register, but you still had to do these online FEMA training courses. I am not sure if that is currently being required for the California Health Corps, but you can start the process there. That is all for me today with disaster management. Other things that you need to do, there is a patient simulation that's going to be really fun, that's linked in your readings, as well as another New York Times, the daily podcast episode that's talking about our national stockpile and our current supply shortages for healthcare workers.